My name's Megan Weisbeck. I'm a student nurse in my third year at Brandon University here. Sun safety for school-age children. So this is children ages 6 to 12. It's just a really important time, we thought, to bring in education for this age group because they're starting to go to elementary school, making a lot more decisions for themselves. Parents might not be hovering over them as much and doing things for them. So it's a good time to get that education in. And about 50% of UV radiation in our lifetime happens before we're 20 years old. Yeah.
How did you go about this research?
So we went about it first kind of looking into what is ultraviolet radiation, the different types of it, using scales to know when it is safe to go outside and what protection we need. Then into sun protection strategies for children that we can teach them, families, schools, and then the heat-related illnesses and how to go about those. And then looking into a little bit more risk factors, the social determinants of health, and how nurses can play a role into this topic. We collected our data all from research articles, there's a lot of fantastic Government of Canada and Manitoba pamphlets, and then a lot of great resources from the Cancer Care Manitoba here. I'll get into UV radiation first. So there's two types of UV rays. So we have UVA rays, which are associated with aging and wrinkling, and then UVB rays, which are the bad ones. I think B for bad. They are associated with skin cancer. They're the ones that cause sunburn. So when we're looking for sunscreen, we want one that is broad spectrum, protect against both. And then kind of interesting, the windows, they will block UVB rays, so that's good, but they won't block UVA rays. So eventually, like, we all have skin that ages over time, no matter how much protection we use. And then we went into the UV index, the different levels of that. This is a great resource as we can teach children and their parents of how to use. They can look on the weather app on their phone and find this to see what level they're at, and then should they be wearing sunglasses, sunscreen, seeking shade, should they not be going outside at all. Like in the midday is usually when the UV is the highest. Clothing, when we're looking for clothing, we want hats with the wide brim covering those ears. Our ears, our neck, our nose, kind of missed places, especially even with sunscreen. Clothing, sometimes you can find clothing that says UV protected fabrics. If not, we want something that's breathable, let the air in, keep us cool, lighter colors the sun won't attract to as much. For sunglasses, look for something that says 100% UV protection, and then like closer to the face fit are usually better. And the big thing for children is to let them pick out their own sunglasses, right? Like, I put on a pair of sunglasses I look good in, I'm like, more likely I'm gonna wear them because I feel good in them. And same thing for children. And then sunscreen, SPF 30 or higher. And then the big thing with sunscreen is to educate people to reapply. Swimming, sweating, reapply after, and keep going on. For us, the big thing was, with research, it's showing that we need to educate this multiple times throughout children's life. We can't just teach them once when they're 7 years old and say, okay, it's good. No, we have to keep bringing it in, along with working with schools to bring in policy changes because of the social determinants of health. And showing socioeconomic plays a big factor of children. Their parents might not be able to afford sunscreen. It's pretty expensive, hats, clothing. So policies that support access to these resources, and then also supporting rules with like at school sports, making sunscreen, all of that mandatory, encouraging shade and taking breaks and water throughout the day before they feel thirsty. Yes, so kind of collaborating with schools and policies and public health to bring that into those clinics and families when they're around. I am planning to go into the workforce, hopefully working rural, and then I know with going into rural, I'll definitely continue my education because like more specialty skills and that kind of thing. I know nursing is lifelong education, probably won't end up back in a university, but I definitely will keep my learning going.